Welcome back to GB News Day. Let's bring you the latest picture on the state of Britain's health services, which has been painted by the British Medical Association. That's the body which represents the doctors across the UK. It's actually warned that the NHS could be on the brink of collapse.
A poll of doctors revealed that more than 2 in 5 of the most senior hospital medics are planning to leave the NHS in the next year. The British Medical Association now calling for immediate government action after the survey suggests that roughly 8,000 consultants suggested pay and pension tax arrangements were some of the reasons they plan to leave.
Well, also 9 in 10 of those consultants said that this year's pay rise, that's 4.5%, was inadequate or completely unacceptable. Let's get the views now of Dennis Reed, director of a non-profit organisation, Silver Voices, and a former trade union official as well. And Dennis, clearly there's concern for the older generation who might be looking to use the NHS this autumn and winter about this news from the BMA.
Yes, older people are at the brunt of the crisis, I'm afraid. I mean, if you look at this, 7 million people who are on the waiting list for routine operations like replacement knees, back operations, replacement hips and so on. And they're waiting months and months and months, even years in some cases, to get into hospital for these very painful conditions. And yes, I mean, every aspect of the NHS is under real pressure at the moment. It's like a pressure cooker, and it's about to blow. So if you have a fall at home, if you have a stroke at home, it might take hours for an ambulance to arrive. When you get to hospital, you might be in an ambulance outside the hospital for 10, 12 hours. Then you get into the hospital and you sit in a corridor for a number of further hours. And I just shudder to think how many people are actually dying on this journey to even get into a hospital bed. So, yeah, it's a critical situation, and it has been ever since the pandemic.
Critical situation, brink of collapse. There are some terrible horror stories we hear, like the ones that you mentioned about people waiting hours for an ambulance. But in the main, the sort of talk of a brink of collapse of our National Health Service, that's overdone, I suggest.
No, I'm afraid. I wish that were true. It is on the brink of collapse. There are 160,000 vacancies in social care now, and 130,000 in the NHS. The NHS can't continue to operate with the demand that there is under these sorts of pressures. There was a 10-year plan for the NHS the year before the pandemic. Now that plan is no longer worth the paper it's written on. And there needs to be a proper, fully funded plan for the NHS for the next 10 years to bring it back to the sort of service that we all want and expect.
Finally, quickly, Dennis, do you have any sympathy for the doctors, particularly as regards the pensions, as someone representing Silver Voices? Because a lot have been leaving the profession because they've actually put so much money in their pension, they're going to get hit with tax.
Yeah, I hear that all the time from GPs as well as consultants, and obviously that is of concern. But of a bigger concern, to be honest, is the thousands and thousands of social care staff and basic NHS staff who are on the minimum wage. I mean, it's those people who are finding jobs in Amazon warehouses and so on because the pay is so low. So I have more sympathy for them, if you like. I'm not discounting what the consultants are saying, but I've got more sympathy for them.
OK, Dennis, thank you very much indeed for bringing us your reaction to that news from the BA. Dennis Reed from Silver Voices.